I used to do mammography, ultrasound of the breast. Before that, I started my radiology practice in 1994, and that time mammography was the top thing as such. I started with my CDR. Ram Mohan was my senior as well as Krishnapur. We were never used to decipher that mammograms because we used to think there is a lesion and it used to turn normal. And if we used to say it is normal, that used to turn malignant. This something simple. There is a thing called thermoscan which can seal that there is a lacunae. I'll just show you what exactly we mean by thermoscan. This is just the metabolism of the breast can be picked up by thermoscan. And here you see a normal breast which doesn't have any high metabolic states and all that. And you have another thermoscan where on the right side you have got hypermetabolic states which was because of some neovascular. Dr. Dattatreya was telling about neovascularity and all that. That can be picked up very early. Everything is see when we talk about breast as such, it's a lymphatic drainage. We need to understand that. And breast is a extension of apocrine gland. It's a sweat gland basically. So what we are trying to work it out is when we have a imaging modality where we can pick up some things which is easily worked out by doing a thermal scan. I'll give you some certain examples. It is number one. It is not radiation. No radiation is involved, sir. It is only picks up the high kind of infrared waves which is being normally generated as such. And yes, this is the funda basically. The temperature difference which comes with a tumor which has got high metabolism. There is a certain temperature difference which we try to pick up with the thermoscan as such. And I just want to show you some of the examples that will help you. We use this particular modality. Yeah, you're talking about Judah Folkman, sir, and this theory of neoangiogenesis, and this you can pick up well before us. Some 2-3 years before picking up a small node, what you get palpate and what you can get on mammography, on ultrasound, you can just pick up initially. You don't have to wait for that long as such. The technology is tremendous as such. I'll just show you some of the. This is one of the differences between mammography and thermal imaging. Again, we try to feel that this is a no touch and there is no need for compression of breast. There is no radiation which is involved. And this is how a X-ray mammography looks like, and this is the depiction of a thermoscan, and we are able to show this particular neoangiogenesis here, and the kind of there is a comparison with the ultrasonography also here, and so this is the normal pattern of a vascular pattern for a normal person. There is almost yellow or green kind of thing you get it as such. It is, yes, it is done in a process. We try to work it on a lot of areas. It is done all by it's easier to work with the computer now, and the procedure is quite simple. Everything is there on this one. And what we pick up after doing the scan is we pick up Th1, Th2. I thought Th1 and Th2 were only with the immunology. Here also the terminology is Th1 to Th5. And Th1, this is the kind of reports we generate. With the high risk, it goes up to T4, T5. This is I'll just show you. This is one of the scans where there is you see the red spots here as such. And this was basically the patient had a tender breast, and it was basically because of the lymphatic drainage. There was an inflammation because of excessive hormonal congestion, and subsequently something. This is the take-home message I'd like to give. We have so many patients of breast cancer, and their daughters and all that. They in their mind something is happening. They keep telling Dr. Garu, I don't want to get into that. What should I do? I have done a BRCA test also. So this is a case of two sisters who had gone for a breast scan, this thermoscan, and mother had a breast cancer, You see on the left side is a 21-year-old daughter and the right side is a 19-year-old daughter. Left side, that blue depiction and all that is a normal cool breast as such. It's absolutely, there's no activity out there. On the right side, she is a 19-year-old daughter, has got some increased vascular markings on both the sides. So this particular cases, we would like to follow up the cases every year and tell them how to go ahead with the detoxification, try to do some oxygen or ozone and what alkaline diet and all that, so that they will not end up into some other power. This is a 25-year-old thermogram whose mother and aunt died of breast cancer. There is on the left side you have got an asymmetrical blood vessel pattern. This asymmetrical blood vessel pattern is a start of neoangiogenesis. So you pick up there itself. You don't have to wait. So later on with detoxification and all that, she went on normal. This was a very, I had picked up from a journal as such. This is the case. 3 mammographies and ultrasounds over the last 1.5 years were normal as such. Nothing was picked up. Patient had some problem on the left side. She complains of pain and all that. On thermoscan, what you identify was there is a increased vascularity, and once MRI was done, in MRI they found that there was a 3 millimeter mass lesion was there. So this particularly there is some studies which were done. This is called digital thermographies as such, and they were compared with the biopsies also. And what I mean to say is, when I was to do X-ray mammography, the false positives were quite high. We were not very specific. Detection was slightly on a difficult zone. We never used to give a report on X-ray mammography. We used to check the patient. Okay, go and check it. Whether ultrasound wise, is there anything else? It was a difficult thing on to put on a paper as such. So with this, things have become quite easy. I can always tell you there are 4 breast lumps are there. From where are you going to do a biopsy? Yeah, there are small 3 centimeters, 4 lumps are there. Most likely factored. From which one you are going to take? You do a pre-thermoscan, see which is hot and which is cold. Hot is there, you pick up that particular thing and you will get the thing as such. So this is one of the simple things here. I thought I'll just fit in because this is one of the modality we were trying to work it out. And